Hello, I'm Dr Anne French and I work in the School of Health and Life Science here at Teesside University. Within the BSc Honours nursing course here at Teesside, we have 4 pathways which we call actually fields of nursing. So we have adult nursing, mental health nursing, learning disabilities and child. The fields are very varied and you may know exactly what an adult nurse does. There's obviously a lot of media interest in adult nursing, and it's projected quite a lot in television programmes and the media. But an adult nurse works in a variety of different settings. The mental health nursing field predominantly works with people who've got some mental health issues, and that might be from an acute condition, or it might be somebody who's got some long-term mental health issues like depression or anxiety. And then we have the learning disabilities field of nursing, where once qualified you'll be working with people with learning disabilities, and that could be in a variety of settings. That could be in an acute hospital setting, or it could actually be within a community setting. And finally, the child field is where you work predominantly with children in a variety of different settings, whether that's an acute hospital, within a person's own home, or within a variety of independent settings. So all 4 areas of nursing are very varied, and within the curriculum you have opportunities of having a bit of a taster in the alternate fields, so that actually when you complete the programme, by the end of the 3 years, you would have an insight in what it's like to look after somebody from each field of nursing. Only obviously predominantly you would be looking after people within your chosen field. Sometimes students ask if there's an opportunity to swap between the fields, and it's really important to know which field of nursing that you want to go into before you enter the course, because you can't start on one field and then swap into another area. The structure of the course over the 3 years is that it's 50% theory and 50% practice. So that means that for 50% of your time you have to have the theoretical component of the course, and 50% of the time will be based in clinical practice. So to qualify and register as a nurse with the Nursing and Midwifery Council, you need to have 2,300 practice hours and 2,300 theoretical hours, and they're split usually 50-50 each year. So you'll have a period of time in university where you concentrate on the theoretical component of the course, and a period of time where you're in practice, and that could be in a variety of different settings. So it could be within an acute hospital setting, it could be within the community or the private and independent voluntary sector, which will include GP practices, care homes, people's homes, supported living, so a variety of different settings over the 3 years. Students typically go on placement to hospital acute settings. So if you are on the adult nursing programme, you would have an opportunity to work in acute medicine, a surgical ward, critical care, which might include accident and emergency departments, it might include intensive care units, theatres. If you were working and part of our child course, you might work within the community. It might be with some specialist nurses, and similarly for mental health and learning disability placements, it could be in acute hospitals, and it could be in independent care homes, working out in the community with a variety of clinical nurse specialists. So many different opportunities to experience the patient journey wherever the patient or service user actually is a recipient of care. Students on the nursing course have access to a variety of facilities. We have some really excellent clinical skills labs, so you have the opportunity of practicing skills before you actually go out into placement, and that's a really key part of the course. It's really important to have the underpinning theory to what you're doing, and to be able to practice those skills that you learn and develop in a very safe environment. So for an example, if you're learning to give somebody an injection, you have the opportunity to actually practice that skill on our, what we would call our simulated arms, We've got a lot of what we would call sim man, sim baby, sim child. So they're all mannequins essentially, which simulate a patient. They do some really good things, so they can breathe, and we have some great technical staff that actually can make them talk. So we simulate those experiences that you have in practice where you feel very safe. So by the time you go out into clinical areas and meet patients and service users, you feel a little bit more confident because you've had the opportunity to practice those skills. So when students are not in placement, the type of things that they learn within the theoretical component of the course are a variety of things such as the anatomy and physiology of the human body, but then it's the application of that learning to clinical conditions. So how does a normal body work and function, and what does that mean when a person becomes unwell? So there are those types of theoretical sessions. There are also some problem-based learning. We get you to work in groups, and that's trying to help you work with other members of the team, which actually will very much simulate what you have to do when you're in practice. When you work in a multi-professional team, no matter what field of nursing that you're in, you will work with different multi-professionals. So if you're a nurse working on a ward, you will work with obviously members of the medical profession, but you'll work with occupational therapists, you'll work with physiotherapists, pharmacists, social workers. So it's really important that you develop those skills of working with other members of a team, everybody working together to provide the best positive outcome for the patients and service users that they're caring for. So some of those activities are simulated in group work within the theoretical components of the theoretical sessions, really. Throughout the course, students are assessed in many different ways. So it might be that you might have to write an assignment, so it might be essay writing of 2,000 or 4,000 words that you would maybe submit at the end of a module. It might be that you have to create a video. It might be that you have to undertake an exam. Sometimes that's a bit worrying and maybe not so popular, but we have a variety of different types of exams that might be writing long answer essay questions, or there might be multiple choice. The key thing is that throughout the 3 years you are assessed in a variety of different ways. And really importantly, at the end of each year, you are assessed in practice. So, as it's already been mentioned, this course is 50% theory and 50% practice. So you have the theoretical components that are assessed, which might be, as I've mentioned, by an assignment, an essay or an exam, but you also have proficiencies that you have to pass at the end of each year. And this might be around how you develop your communication skills. It might be a particular skill about something that you've learnt in practice, but those proficiencies need to be achieved at the end of each year. And obviously they're developed over the year. So what we would expect you to be able to achieve at year 1 is very different to what we would expect you to achieve at year 3. So you're building each year on those development of those proficiencies and your skills. So the types of skills, knowledge and experience that we're looking for in an applicant and a potential student who's going to join the workforce within the variety of different areas that you can actually work for is really, I would say, a passion, and it's a passion for caring for somebody, to have an interest in being able to contribute to promoting a positive outcome for patients and service users. So you need to have a real interest in people. You need to be able to think about the development of those interpersonal skills, really communicating to people, taking an interest in somebody's story. And sometimes that can be a bit worrying if you haven't had the opportunity to have experiences where you've been able to talk to people quite a lot. But generally, if you are interested in people and you're able to ask people to tell somebody a little bit about themselves and what their experience is, mostly people like to talk about themselves and what their experiences in life have been. So really just that general interest in people is really important. People come with a variety of different experiences and knowledge. So some people will come and have been able to have worked in healthcare previously. Some people may have not had the opportunity to work in healthcare at all, and both are fine, because both come with a variety of different experiences that contribute to your learning. So if you haven't had the experience in healthcare in the past, don't let that put you off. If you have had that experience, then that's great, and hopefully we can help develop and build on that existing knowledge. So really an interest in people, but also you could come with a variety of different experiences. For example, if you've been working in retail, working in a shop, about talking to people, about helping, giving that customer service, making sure that people have got, whatever they're interested in. So there's a variety of different things that helps contribute to a good applicant, and it's really demonstrating whatever experience and skills that you've gained, how you think that would transfer to working as a student nurse. So a variety of different experiences, as long as you think about how you can apply that to being caring, compassionate, and really embedding what is the NHS values. If I was to be asked what's the best bit about the nursing course at Teesside, there are a variety of things that make Teesside stand out to have been a really good experience for student nurses. And one of them is the variety of experiences that you get when you come onto the course. We work really hard to have a hub and spoke model, which means that you might be based in one area, but you get the opportunity to go out and experience so many different areas. As I said, wherever a patient or service user may access healthcare, we try and get you to have that experience. So I think that you've got experiences in a wide range of settings. I think that's really positive. I think at Teesside we have excellent partnership working. We work hand in hand with our partners, and whether they are partnerships as in the major trusts that you probably would be familiar with, but actually our independent sector partners, GP practices, we have a really good relationship with them. Our clinicians are involved in interviewing, they're involved in teaching, and they welcome our students out in practice to try and make sure that they get a really good experience. And I think the facilities here within the School of Health and Life Sciences are excellent. We get really good simulation experiences, and you also get to meet the variety of lecturers who have all worked in clinical practice, so they come with a wealth of knowledge and experience that they apply to their teaching. But also you get to work not only with lecturers in nursing but other professions. So for example, you may get to meet some of our paramedic team, you may get to meet some of our learning disabilities, mental health, nursing, so experience across the fields. And one of the very good unique things about the course at Teesside is for the first year all the fields are taught together, so that you get a variety of lecturers who may be from different backgrounds. So if you're an adult nurse, you're not just going to be taught by adult nurses, you're going to be taught by lecturers with a wealth of experience. So if you want any further information about the nursing courses here at Teesside, then please book on an open day or look at the website or engage in the chat facility.